Hello. Looks like we've got connected to audio. Nice. We're all here.
Oh, sorry.
How you going, guys?
I don't know why it does that.
Oh, the connecting to audio thing.
No. The video just comes up straight away. Uh, Cuts me off.
Oh, really?
Yeah.
That's annoying. And I can
So
see
we
your
had,
face in the background there.
you know Mark? Do you remember
Yes,
Mark?
yes,
Oh,
we
yeah.
met at on that Friday night. Was it last Friday
Yeah. Meet up.
now? Very good. Yeah, nice to see you. How you
Oh, there I
going?
am there. There you go. I'm coming in and out. Look at that.
It's because you got
I could do
your
a disappearing
background
act.
on.
Let me check myself.
Oh gosh. Yeah, it's now you're
What was that movie called? Ghost?
It's great for playing tricks. We do telehealth with kids, and yeah, we use the backgrounds all the time for our little magic. Do you like my finger? I sliced
Oh,
it
geez.
this morning. I know. I was opening a packet and with the wrong knife. Yeah.
Wow, you did not. You stuck it in a PowerPoint
I did a
and
very good job with it.
burn your finger.
Yeah, it's
Do you
too bad.
mind? There it
Oh,
is.
what happened here?
I was sharpening my knives last weekend.
Oh,
Yeah.
okay.
So
And
it's
got yourself?
contagious.
And it is completely healed up.
It's contagious.
Is that
Completely.
because of your magic water?
Yeah, the magic.
Thank you. Good job.
Yeah, there's two actually.
Yeah. So you saw it the other day when I was here on Monday.
Is that the same finger?
I
So
know,
I need
right?
to
That's the
see I
same
need to
finger.
see you for my finger, do I? To get my magic water.
That's it.
Yeah, that's it.
All it
Except
does is
I'm not allowed to
start.
get it wet for 2 days. It's got skin glue on it.
You can also see Dr. Scott. He's got the magic water as well.
We have a water protocol
Oh, that's
just for
right.
fingers.
Yeah, you stock
Just
some
for
there,
fingers.
don't you? Yeah.
Yeah. It's pretty cool. It's good stuff.
Yeah,
That sounds amazing.
It actually works.
You've still left me wanting more from last time we caught up. So maybe you can fill me in now. You said you suggested we catch up. Here we are.
Cool.
Oh, well, if Leanne, have you shown Leanne you understand Ross and the effects it has in our body, yeah?
Ross.
Reactive oxygen species?
No, not up with that term.
Oh, okay.
Tell me more. Tell me more.
Just observation.
I don't know. I've just been invited to sit in on this, so I don't want to take over anything or
Oh
anything
no,
like that.
it's informal, and then at about 3 o'clock, I'm just going to do a quick whiz through around how collaboration can lead to innovation in healthcare in Australia, just to get us started with someone doing a bit of a prezzo. And then we'll sort of whiz around more about what people do and stuff like that as we grow, because obviously I only just started this like literally a few days ago. But we've already got something like 17 members in a few days, so I think we'll get more turning up and being more comfortable with this. So I am recording it so that people can check us out before they come, because they want to know what they're in for, especially in the healthcare field. Yeah. They want to make sure they're making a good use of their time. But really, it's the catching up informally is often where the greatest value is. Like when I used to go to courses, it was that lunchtime chat where they were the light bulb moments, and that's what I want to replicate here, is some of those light bulb lunchtime chat moments. And then we'll have a bit of an opportunity for a bit of a brief sort of PD, professional development, for 10 minutes. And then
that's pretty cool.
Find out more about others and see where the synergies are, and if people can, and ideas come from that, and that's kind of what the presentation's on as well. So go for your life. Tell us more.
Well, Leanne, can I do a little magic trick?
Do a magic trick. Go for your life.
Okay. You and Scott have a chat for a minute. I'll just go and get the ingredients for the magic trick.
Oh,
and then I'll show you something.
That
very
sounds
special.
fun. You might have to turn your background off for that, though.
I have to turn my background off.
He's good at the suspense. See, we said lots. See, magic tricks and suspense. We called it
Bond. James Bond.
We called it. We knew.
Just trying to.
And I'm trying to work out if we have Samuel or Alejandro. I don't know how to say that in the right way. Alejandro. obviously listening in and checking out who we are and what we're up to. But yeah, feel free to
There you go.
join in and go for your life.
Is that better?
Oh, there we go. You don't need a background. Your background looks amazing.
Yeah, that's the clinic actually. That's
I don't need a background either. Let me stop mine. It just was on naturally. I didn't even put it on. Let me just go choose virtual background. None. So here's my clinic. Isn't this the beauty of Zoom meetings? You get to check out where each other works.
yeah, that's it pretty
Or
much.
sticky beak at people's houses. Wasn't that the best thing in COVID? Was you got to sticky beak at how everybody else lived?
It's the only place you can go.
More
You want to
risk.
do it on the bench, Mark?
Yeah, you okay.
Yeah. I'll just bring this stuff there.
Everything's ready.
All right.
Everything's ready.
I'm gonna have to move this around.
No, that's okay. I can come around there if you like.
No. I'll bring it around here and put it on this corner. Then we should be able to see it.
All right. You got glasses out
Yeah.
there?
I've seen it before, so
Yeah.
it is pretty.
It's like jokes. You can only say it again in front of someone if they ask you to share it. Lucky I asked him to share it.
Yeah, he's got a video. I'm pretty sure it's on YouTube. And actually, it's the same
Oh,
thing.
really? Okay. Yeah, and the volume, once you move away from the front of your screen, the volume's a little bit harder to hear.
Oh, can't you hear me? Can you hear me?
Yeah, I can hear faintly. I'm just going to turn my volume up. There we go. Okay. I'm going to maximize if I can. I'm going to try and maximize you on my screen. Spotlight for everyone. There we go. How is that? Look at that. A spotlighted
Oh,
for
wow.
everyone.
That's really good. Actually,
There I am. So there is just a little magic trick here that is far more serious than what we can take for granted.
Okay.
And Leanne, this is a glass, and this is a glass. This one has tap water from our local Sixth Sense, kitchen tap.
Okay. Yep.
This is my magic water.
Yep. Do you like how I called it magic water? You're liking this? Is this what you call it? Because I just naturally called it that.
Well, you've cottoned onto something. It's a saying, and I am in the industry known as Watermark
Yes.
with his magic water. So when I've
Please
attended
don't.
different,
Not magic water.
yeah.
I'm thinking.
So this is my drinking water,
Right.
which says I have a drinking problem. Yeah,
Oh, yeah.
Yes,
You're
you are.
drinking water in the flask.
I did too.
there's tissue there.
So with your cut finger, this is why I'm doing this.
Yep.
With your cut finger,
Yes.
you've heard of no doubt heard of betadine wound care drops.
Yeah, I love betadine.
Yeah, okay. It's an iodine-based product, right?
Yes.
Okay, I'm going to put some drops into the tap water.
It's still the drops because when I tried buying it, it didn't seem to sell in the old-fashioned little droplets anymore.
Yeah, they do. Yeah,
Okay.
the chemist still does.
Okay.
I'll put the same amount of drops into each glass.
Yeah,
You can see
I'll
that?
take your word for it. Yep.
Okay. Iodine or betadine is a oxidative liquid. It kills healthy skin cells as well as unhealthy or infected skin cells.
Okay.
It won't kill us unless we drink too much of it,
Yes.
because we're multi-trillion cell organisms, right?
Okay.
So betadine in tap water is simply diluted betadine. You can
Sure.
see that, can you?
Yeah, can see that. Yep.
Betadine in my magic water.
Yes. Oh my goodness. That's exciting. Wow.
That is pretty cool.
That is
Right.
magic.
Now, if you think that's cool,
I
I'm
think
going to do
that's
it
cool.
again.
Okay.
Okay, so let's say Well, you understand our bodies are 78, 80% water, yeah?
Yep.
Intracellular and extracellular. So inside
Yes.
and outside the cells.
Yes.
If our human body aquarium is full of dirty water,
Yes.
how long would it take to clean that up?
Okay. Wow. That's crazy. My goodness.
Now, I would like you to think about internal health,
Yes.
cellular health, like health on a cell level, the Krebs cycle, production of ATP, proliferation of cancer, neurological conditions, diabetes, all that sort of thing.
Okay.
I'm going to leave it there.
Uh-huh.
You just saw what can be achieved.
Wow.
Yeah.
That's what I said.
I have a, yeah, go on.
So our audience being health professionals, you know, we always have lots of questions, and I know you won't want to say too much. I guess the sorts of questions that health professionals might think is, where did you get this water? How is it made? What's it made of? Why is it eliminating all the chemicals that we have? Oh, you know, all those questions. You must get them all the time.
I was in New Zealand a couple of years ago, just before COVID, and there was a couple of practitioners at this conference I was at. They were absolutely blown away with this little demonstration, this visual, and
Yes.
the questions that came from that resulted in them taking it home and teaching other physicians how to help their patients improve their inner physical, mental, emotional, and financial health as well.
Yep.
So I was very pleased with that. However, there is a lot of skepticism in the world,
Yes.
and to balance that skepticism, this water is a very special water, as you just saw. It has very special properties to it. It is not H2O. This water is produced from a processor where the H2O goes into the processor and uses the electrolysis through ionization of water molecules to produce a far different product totally. This is H3O2.
Wow.
So what you just saw happen is in I guess a little medical or sciencey terms, this oxidative liquid is full of atoms that have lost their electrons, making them oxidative, very similar to oxidative stress in the human body. What has happened is the additional hydrogen molecules in my drinking water
Yes.
has donated hydrogen molecules, H2,
Yes.
to oxygen that has lost their electrons, the atoms that have lost their electrons,
Yes.
which become reactive oxygen species in our body. They're cytokines that cause damage and disease. So
Okay.
how simple is that?
So reactive oxygen, you're talking to a health professional who knows nothing about this, is obviously bad for our bodies.
We actually produce some reactive oxygen species that are good and healthy for our body because they do fight disease and they do fight, say, influenza and things like that. They do fight COVID.
Okay. Okay.
And are produced by our body's own immune system. However, it is the free radicals that are freely produced from oxidative stress that need to be flushed out of the body. So we can turn around and look at detoxing our body,
Yes.
just like I did that water, and very simply, just have a drink.
Drink it. Wow. So none of this awful colonic flush out, drink the water.
Yep. If you want to have a very severe Herxheimer's reaction, you could using this water. I do not recommend it because it's quite a messy process.
Right. Wow.
So it's an accident.
Your cells will go into hyperdrive on a cell level. Your production of ATP will increase from 30 to 40 measurements of ATP to potentially hundreds which will flush the toxin straight out into your, through your kidneys and out the other end as well. And boy, you'll make a mess. Well, it happened to my insurance broker on Parramatta Road. And there was no toilets. None of the surveys have got toilets.
Was that from what, drinking too much, or he did the other end flush out?
Yeah, he was diabetic.
Yeah.
He was way overweight.
Yeah.
And he was very thirsty. He was dehydrated, so he started drinking very high levels in volume and high levels of pH with additional hydrogen, oxygen, and hydroxide ions.
Right.
And I asked him not to,
Right.
especially because it was a long drive from Brisbane to Sydney to get to his conference.
Right.
And this actually caught up with him on Parramatta Road before he could get anywhere.
Oh no!
I
hope it's a bit of change of clothes with him.
He had plenty of change of clothes, but yeah, opening the doors of your car to do your business on the side of Parramatta Road and pick out traffic was terrible. So
wow. So
you say
it's very medicinal, and you can't drink lots of it like you would just drink water.
You can. I drink about 4 to 5 litres of this a day. That's a 1 litre bottle, and this is my third one
Okay,
today.
so like most people wouldn't drink more than that.
I drink about 3 litres plus a day.
2 litres.
Cool.
No, 3. I do about 3.
Yeah, that's good. And a lot of people don't, Leanne, don't drink enough water because, chlorinated water, fluoridated water tastes horrible. It smells horrible. It can
so
be
does that taste better, does it?
Oh, this is nutritious even. Seriously.
So I can't hear you much, Dr. Scott. What would you say? Is there a flavour linger in the mouth?
No, it's the opposite. It tastes like,
Just put your mouth a little bit more in front of the screen, because otherwise your mic won't pick up your sound.
Oh, you can't hear me at all. Okay.
Not too well, no. Well, maybe you both come back around again together.
Yeah, we'll do that. Leanne, what is your profession? What's your professional day look like?
Yeah, so I'm an occupational therapist. So we work with 3 to 35-year-olds, mainly in groups in North Lakes and within half an hour. So yeah, we've got a multidisciplinary team here.
Okay.
So basically, yeah, I found that it doesn't taste as you can take like I've been drinking it for so long now. If I drink anything out of a tap, I know the difference straight away. I can taste the chlorine in it.
Yeah.
So it just tastes better. For me, it tastes better. And everyone that I've given it to says the same thing. It does taste better.
So
I give it to my patients as a sample.
Okay. Yeah, right.
To get them to sample it.
Oh, cool. We drove to Exmouth up past WA, I might have mentioned, to watch the solar eclipse just not that long ago. And of course you get all the different, one of the topics of conversation was all the different flavours of the water as you go through South Australia and then WA and back again. And it's so bizarre,
Yeah, that's exactly right. It depending on where you are, it changes the taste. I do remember that in Melbourne. I just went there in February, and the water just tasted terrible down there.
Oh, okay. I didn't notice the flavour too much, except if they were doing work on the pipes and suddenly it was disgustingly brown for a period of time.
The other thing is it depends on how far you are away from the towers as well.
Oh, okay, yeah.
Because that'll change the pH of the water as well.
So, Mark, I know you've just walked away. Do you have a plant that makes this stuff? Obviously, it's a made product.
Okay, you're going to be very happy to hear that the Russian technicians could not design this technology. The Korean technicians could not design the technology. The technology was designed in Japan, which included the original Sony electronic engineer from the original Sony manufacturing company. They made the Sony Walkman, Discman, and all that. And he teamed up with the world's leading oncologist, Dr. Haran Shinya.
Okay.
Dr. Shinya heads up the Beth Israel Institute for Cancer and Oncology.
Yeah.
He specializes in colon and cancer treatment. And he's never lost a cancer patient yet.
Wow.
Really?
When I researched him, he had conducted over 360,000 procedures.
What do you mean, surgeries? Is that what you mean?
For cancer patients, polypectomies, panendoscopies.
Oh, okay.
You're familiar with the polypectomy and you know, the snare to remove the polyps in the colon and bowel and
I know they like to burn them off or something, isn't it? You mean?
yeah. He's also the inventor of those medical procedures.
Wow, that's amazing. Yeah, who would think of that, burning the insides?
Yeah, I know, right?
Let's burn someone's ass.
I know.
That makes sense.
I know. I got burnt on the inside recently, and I'm like, who would have thought of that in the first place?
Yeah, Dr. Shinya. It's called the Shinya method.
Oh,
Wow.
Yeah, it's actually called the Shinya method. And so I present him and his quotes and his book as along with other authors, medical physicians and authors of their own books in my healthy water review. So he and
Just come a bit more. Just center that monitor between the two of you, because your sound's a bit in and out. Sorry.
okay,
Sorry.
there we go.
There we go.
And I'm sort of hugging up to Scott.
Yeah,
so
yeah. I hope no one's got COVID there.
And so they got together and they discovered how to make the technology to produce this healthy water. And they did that back in the 1950s. So it's only been around a few years. And they discovered that the water had therapeutic beneficial effects on humans, animals, and plants. The Japanese Ministry of Health approved the water and certified it, the machines that make it, the processes that make it, as medical devices in Japan.
Right.
They are not medical devices in Australia because they've never requested the certification from Australian TGA. And the TGA just put a premium price on it and it'd be out of our reach in the general public. So my company, along with Dr. Scott, we actually provide these to people around the world globally.
Right.
And my warehouse is in Sydney, in Macquarie Park.
So you would you say you're a supplier, not a manufacturer?
Absolutely.
Yeah.
Yeah. And you know, they build these devices to the same standards as every other medical device. And they are built to last 25, 50 years. If you bought one, you would never, ever have to replace it. Yeah.
Who would think of designing a new water to do stuff with oxygen molecules?
Well, that's really...
Well, I suppose someone who's dealing with sick people all the time. That's usually how it works.
He's been looking up people's backsides for years.
So, all right. So show me your finger again. So you cut it with something.
Oh,
okay. Yeah. How long ago was that?
That was last Sunday.
Okay.
And on Monday.
Okay. Sound's still going out again. Sorry.
Yeah, that was last Sunday.
Yeah.
Dr. Scott saw it on Monday. And it's fully healed up. That was nearly halfway across my finger. It's all closed, scabbed over, healed up from the inside out.
Okay. So how do you explain, how obviously it's the cells and everything like that, how that's hastened the healing process? Because I'm curious. Okay. I don't want this thing going on forever.
I know. And every time you touch something, it hurts, right?
Well, I'm just avoiding touching anything with it. Thankfully, it's my non-dominant hand, but yeah.
Okay. Yeah, that's my non-dominant hand as well. So The processor actually makes another water, and that water is called electrolyzed oxidative water. It's a 2.5 pH strong acidic water that the American EPA and the WHO have on their #1 to-go-to list that kills every viral or bacterium known to man that's stronger to kill than SARS, SARS-2, and all coronavirus.
Okay.
And you and a lot of Australians have never heard of it.
Right.
And it's their #1. It's on their list N on the World Health Organization site. It's on the list N.
Okay.
I can provide you all that information.
Because I did when COVID was like bigger. I did go to, I think I went to the TGA site to look up, you know, which are the more reputable products to use and all that sort of stuff. So are you saying it's on there?
It's not on the Australian TGA site. It's on the WHO site.
WHO.
And
Yeah.
I can in fact, if you Google the WHO list N and healthy, it's the very first.
Yeah, it sounds a bit in and out. Okay. All right. Let me do that. So Google. Okay. So WHO.
Actually, you've got it. If you want to share screen, you could bring it up.
Oh yeah, share screen.
Fine,
Oh,
yeah.
I'll just got to enable screen sharing. Hang on. I actually remembered for once. There we go.
Yeah. Open up your folder.
No, I gotta connect it.
Oh, okay. It's on a USB, is it? Okay.
You can put the link in the chat if that's easier, and then I can screen share it.
Does Scott have your email address? Because we can send you more stuff. Yep, you're in. Okay. He's got his hard drive connected.
I will put my email address in the chat. info@6
I did have a card here.
healthcare.com.
That's all right. Were you able to find it?
So, okay, so I sliced a flap off my finger, really disgusting.
Yeah.
How long do you reckon that would normally heal versus with this?
It'll take
Water.
2 weeks. 14 days, 2 weeks under normal conditions.
Yeah.
Web links.
Or 7 days or sooner.
Okay, sounds good to me.
Go to your folder with meta articles, and there should be a folder on COVID. And all right, heads, I've got my list N right here. There it is. List N. Yeah, list N. Products with emerging viral pathogens and human coronavirus claims for use against SARS and COVID-2.
No, I don't have it.
You don't have it?
No. Research articles.
Okay, try research articles, medical
She
literature.
gave this to me last year.
Yeah, she's probably cut that folder out. Oh no, COVID, see, top left. There you go. List N.
Oh, there you go.
There you go. All right, now screen share.
There you go.
Oh, list N. Okay. Yep.
Yep. And the very top one, hypochlorous acid.
Yeah.
That is what the processor makes. And if you look on the right-hand side, it kills harder to kill pathogens than SARS-CoV-2. SARS-CoV-2, COVID-19.
Right.
Emerging viral pathogen claim.
Yeah.
Okay. So how's that related to the water product?
Okay. This particular water is used in plastic surgery, in wound care, and in wound care, it stops bleeding in seconds. Dr. Scott is seeing photos of what we call a standing knife
You're gonna have to spin the screen in the middle again.
sorry.
It's volumes going in and out. Just if you just turn
Ah.
your screen a little bit more.
Sorry.
It's just
How's
yep,
that?
yep. Should be good.
I think he's writing to you, Leanne.
There we are.
Info.
good.
It's
Okay. Yeah, all good. So so the relation so is this water called an acid?
I beg your pardon?
Is the water that you were drinking, the special one, called an acid? Is that the name of it?
No,
No.
no. What it's referred to in the scientific literature as electrolyzed reduced water. The acronym is ERW, and you should be able to log into your PubMed or NIH, Elsevier, whatever med site you choose, and you should be able to use Google Scholar as well. Not just Google. Google's full of
Google
rubbish.
Scholar, yeah. Since before was when I was researching telehealth way before COVID hit. I use Google Scholar as well.
Yeah. Like that, it's a good, useful site. It
just
doesn't
a
get
supplementary one. Yeah.
Yeah, it's a good
I didn't
supplementary.
find it as good as the others. Just I'm not that familiar with it, I think.
So about 5 years ago, when I was doing some more research, I simply researched ERW, and then whatever disease or condition, whether it's diabetes, cancer, leukemia, men's prostate. In fact, with leukemia and men's prostate, I found research articles where the researchers in clinical trials and whatnot were doing on a dog model.
Yep.
They had 100 dogs, and I think 50 in each group, their control and whatnot, and they had a 100% success in curing, it's their words, right? In their paper, curing prostate and leukemia.
Wow.
100%. And that, my dad had a prostate issue, and I was looking for him, and I found that. So,
Oh, okay.
dad,
Is that how you came across it?
that's how I came across it. Yeah, I just searched ERW,
right,
and prostate, and what I came up with was a publication which I think Dr. Scott also has. I've provided Dr. Scott with these publications, and it's huge.
So did your dad use it?
Yeah, he ended up passing away from progressive aphasia in the brain.
Oh, sorry to hear that.
He had a mole surgically removed on the left temple on the side of his face, and unfortunately the surgeon sneezed with the scalpel, and it stabbed his temporal lobe, and he had a arterial bleed, which was cauterized immediately, and he was rushed to hospital from that surgery to a local hospital for for some scans and whatnot. And it healed up and all the rest of it, but unfortunately, without any oxygen supply to the temporal lobe, the lobe died, the tissue died and became necrotic, and he had a necrosis growth of brain tissue that continued, and the condition for that ongoing, which cannot be reversed, is progressive aphasia.
Right.
So he passed away from that. It caused all sorts of other conditions like onset of dementia, speech conditions, swallowing conditions. He couldn't get his esophageal tract to work, and all that sort of thing. It just wasn't happening, and it caused him an eye stroke on one occasion.
Jeez.
And it caused another mild stroke down his, I think, left side. And a surgeon at Redcliffe Hospital attended because he saw my dad's name there, and they were good friends.
Okay.
And he came in to see my dad, and he couldn't believe Dad's condition.
Oh
He'd only seen my dad a month earlier and couldn't believe the condition. He was very upset. And Dad was mumbling gibberish when the doctor was in the room.
Yes.
And that was Dr. Garrity at Redcliffe Hospital. And he left the room and had a conversation, and then with someone out in the corridor to get some scans done for my dad and whatnot. He wanted to get some extra work done for my dad. I guess work out what was going on.
Yes.
And then my dad spoke ever so crystal clear, like we are talking down.
Yeah.
He said, "Am I buggered? Am I going to die?" I said, "Dad, we're all going to die, just some sooner than later. But you're not dying today, not today."
Yes. Wow.
There you go. Enlarge that.
Okay.
Yeah, you can see I've highlighted it in yellow.
Okay.
It is still-
Yeah, just share your, you're trying to share your screen?
Yeah, just hold on.
Well, that's
There
a
we go.
very devastating story. I didn't even think about, I mean, of course there, there's risk of human error and stuff, but that's devastating to the max.
Yeah. So what do you think of that revelation in front of you there, Leanne?
Wow. And what year was that written?
Go to the top. Whoop.
I'll be at the bottom. Normally. $15.
2015.
Not that long, is it?
8 years ago, yeah.
But what, yeah, I guess, you go, why does it take so long?
Well, you talked to Dr. Liz. Oh, you haven't met. No, you haven't met her.
Oh, Dr.
So she
Liz,
was-
yeah, I met Dr. Liz. Oh, so she's up with this stuff?
I'll just stop sharing this. Is that okay?
Yeah, yeah.
Yeah. So she's got a PhD in nutrition,
Yeah,
and she did a lot of her research on cancer,
yes.
and she found benefits of changing diet and implementing nutritional protocols
Yes.
to stop. Yeah, I know.
That's bad. We just found your business cards.
Ah.
They're underneath my tablet.
So so this is a pretty cool story. This is Queensland Health at its best. So she was working for them doing research on cancer, got great results,
Yes.
did clinical trials, and got great results. And so she had all this peer-reviewed literature, and two of her friends came to her and said, "I've got breast cancer."
Yes.
And she asked them, she said, "Has anyone talked to you about nutrition?" And they
Yes.
said, both of them said no,
Yeah.
not one. Not,
Yeah, that's
Yeah.
shocking, isn't it? Yeah.
So that's when she went back to the bigwigs and said, "What's going on? Why hasn't my literature been put in practice?"
Right. Yes.
And they just said, "Well, it just takes 15 to 20 years before any literature actually becomes implemented in our hospital system."
Yes.
So she was like, "What?" So that's why she became a private practice. She went into private practice.
Because we've got a nutritionist who, we employed, but then COVID hit. And so that became tricky, but now it's not so tricky. And yeah, like studied functional medicine, functional nutrition and stuff like that. Yeah, there's definitely scope for more of that. I think it was you and I, Dr. Scott, talking about, like nutritional changes, things like low carb with diabetes and stuff like that, or keto and things like that, and doctors advocating it and then risking getting a slap over the wrist by APRA.
Yeah, we have to be extremely careful what we say. The
Right.
TGA, et cetera, and we've got to be careful. We can quote what is written in
There's articles.
published articles, of course.
Yeah,
Because
okay.
we can reference it.
And you would have seen in that last one, Dr. Scott just shared, shows a 100% cure success for prostate leukemia. Like, hello.
It's
Yeah.
pretty cool.
Wow. Okay, cool. Well, I'm up for some water. I can pop in, Dr. Scott, and grab some water for my finger if that's what I have to do.
Yeah.
Whereabouts? So you're practicing at North Lakes. Whereabouts do you live, Leanne?
Well, I'm not going to share that on this. This is going to go public.
Oh, no. Okay. Do you live locally?
Yeah.
My point is, if
I'm
you
in
live
Moreton
locally,
Bay.
you can either come to mine or Scott's and and collect some water. Yeah.
Okay. And like, so how would I treat it? Like just like dip it in.
We've got an article for that too.
Okay, cool. All right, we'll chat more later.
I'll
So
just
what I
try and
might
find it.
do,
It's wound care, isn't it?
before,
Wound care.
yeah, cool. I'll chase that up with you guys when we finish. I'm just going to do a quick whiz through around, I guess, some of the ways where collaboration can lead to innovation in healthcare, and I think it ties in with what we've just been talking about. For example, we've got published articles back from 2015 where even health professionals like me still haven't heard of this stuff. We've got Dr. Liz's research, which, you know, they're saying is going to take 15 years to implement, which is, you know, there's lots of factors there that are very fascinating. So I just whacked together a bit of a quick presentation on how collaboration can contribute towards innovation in healthcare, because that's what this, I guess, this meetup group is all about. Just by those informal chats and working out where the synergies are, it just generates new ideas, which, as we saw, so I'll just screen share. I'm not going to go into detail with anything too much, but just a super quick little.
Can you still screen share?
I should be able to. So I think it's this.
I had this problem last night with another lady. She gave, yeah, you go.
Yep, she's screen sharing.
Looking
Yeah,
good?
there you go.
Okay. All right.
Yeah, collaboration can lead to innovation in healthcare. Yes.
Yes, that's the one. So I'm going to now see. No, it's not going to do that. Okay, we'll go back there. So I'm going to have my head turned because I just stop sharing and move it and then do it again. Here we go. There we go. Blah, blah, blah. So then I don't have to crane my neck the whole time. Get rid of that one and bring up that one. Okay, cool. That way I'm just looking comfortably where I want to see. Okay, let's share now. It's going to close my chat so I've got a bigger view with you guys. All right, share. Number, yep, PowerPoint. That should be the right one. There we go. Cool. So yeah, just did a sort of I wanted to get as broader thoughts on it as I could so that we can appeal to a broad think tank, I guess, through these meetings as we grow. I think there is interest in it. So on those membership questions for Meetup, you know, I was asking about what people's dream healthcare would look like if we had no barriers, and, you know, a lot of themes of accessible for all, some talking about wanting it to enable free time. So I'm assuming that comes from health professionals themselves who are just, you know, probably on the verge of burnout. So yeah, but accessibility was a big one, but I just thought I'll just paint it with the biggest brush I can, the topic, and you know, because I think it's through that collaborating and sharing of ideas, it's almost that, you know, 1 + 1 = 3 that I'm sure we heard someone talking about a while ago. I did anyway. I went to the mental health forum and one of the speakers was talking about collaboration and how when we collaborate, 1 + 1 = 3. How good is that? That is so good. It's more than just the parts, individual parts. So yeah, obviously we've got me and Christy, our allied health manager, pictured there as well. So we actually won the Moreton Bay Business and Innovation, Accessibility and Inclusiveness.
Can see that there, yeah.
Last year, and we're like, yeah, we probably, you know, we are innovative thinkers. That's what we value, and we want to see more of it, really. My goal is that we end up not having to keep putting all this money towards disability and sickness because we've gotten on the front foot with it by doing things differently, and then we can have that focus on wellness that the state government's now looking at, which is great. So yeah, obviously we know that Australia can be quite innovative. Things like the cochlear implant, how good is that? We're innovative thinkers. We have to be. We're a little bit more remote. We sort of need to do things well where we're positioned in the world. So I think we're in a good position to lead the way. Obviously we've got our challenges in healthcare around wait lists and that focus on disability and sickness, and it's taking a lot of money, and we just, doesn't matter how much money we put at it, we're still on the back foot. So we do need those innovative solutions to get on the front foot and stay there.
Yeah, they're still ramping.
Yeah, ramping. I mean, just it's not necessary. We just got to do things differently. There's got to be a better way. So yeah, it's all about wanting to work together with diverse stakeholders. And I'm not just saying only health professionals, health and associated, even like admins, you know, in the health setting, they know a lot. That they've been looking at a lot over the years. So the broader sense, and also the education system as well, because I want to have them collaborating with the health professionals, get in early. They know what we need to have, and like just try and make it happen basically, instead of dealing with it in isolated buckets and silos. So yeah, we've talked about that. There's obviously lots of collaboration that occurred during the whole pandemic, peak of the pandemic system as well. There are lots of examples where there's cross-sector collaborations in healthcare in different contexts and settings. We just want to do that more basically. You know, you can have a collaborative research efforts between the unis and research institutes and healthcare organisations. So a bit like, you know, what Dr. Liz was doing and some of the research that you've talked about there, Mark. And then, you know, the partnerships and everything like that. So it's about trying to find out, is there a win-win? Is there a synergy that we can progress and move forward more broadly? You know, there's your clinical trials and sharing data. When we do that, we're going to get a bigger pool of results. And then we're going to be able to get more of an idea more quickly on what's working and not working as well. You know, collaboration between unis would be good. Instead of probably more focused on competition around who's publishing what, a bit more collaboration between them as well. You know, more of that would be fantastic. This concept of innovation hubs and incubators, you know, specifically and deliberately and purposely setting up space and time where people can be, you know, a think tank around innovation. Everyone's just so busy on the treadmill. They haven't got time to put their mind to it, and we really need that. So I know with the state government's plan, Health 32 plan or whatever it is, I don't know what it's called, you know, they gave them 12 months to work it out. So that was lovely that they actually provided the time to work out which direction they wanted to go in. So I was pleased to hear about that. So we want more of them around Australia. This, you know, consumer-centered design, you know, them co-creating, so them having input as well. So I'd love to see consumers here as well, help contributing to innovation. A lot of what we do in my business, we do because of the input of the people that we work with. That's made us who we are and who we love, you know, the work we love doing. So it is important to be flexible. And, you know, it's that sort of bottom-up influence on how we do things instead of that top down. Sharing best practices is always a good one, and having different platforms and networks to be able to do that on, because one group may have worked out best practice, but how's that getting communicated to another group? So that's something we want to work on as well. Influencing policy as well, so not taking 15 years to adopt, you know, fairly.
That's a big ask. It's a big ask.
Do you know, it makes a certain mind though. I when I worked in government, I recommended a fairly radical change that helped reduce assessments on hand from 13,000 to none now. But it's about knowing how to communicate it in a way that a minister can swallow.
Yeah.
This is already a precedent here. It's very similar to that. It's just being applied in this area. And just helping them see that it is doable. It's not going to cost more money. It's going to save money. All that, you know, as long as we can think like them, you know, there is potential to influence policy for sure, especially when they, you know, their hand is forced to. When COVID hit, that sort of made things happen quicker than it would have taken otherwise. So that is a positive, the silver lining on some fairly dark clouds in that sense. And obviously around funding and investment. So when I went to a forum and asked, well, what's the next step in partnerships and collaboration in terms of innovation in healthcare, the answer back was kind of, well, there's no money for it. So, and I'm like, well, that's kind of not okay. So I'm like, okay, let's just make something happen. Let's just start the first steps, you know, because little players like me want to know how we can help, and the big players, don't necessarily liaise with us, and we want to enhance that liaison between all players, big and small. And sometimes I saw on LinkedIn recently, it said like problem, and you've got like the you know, that sort of iceberg picture, and like you've got the more vocal people at the top trying to give their solutions to the problem, and then the quiet person down the bottom of the iceberg underwater, who has the solution, but because they're quiet, that hasn't been brought out. So the person with the solution isn't being heard. So we want to have ways that people can be heard, particularly those who do have the solutions to the problems. But yeah, incorporating, you know, venture capitalists and other funding agencies to try and support the innovation as well. International, hey, let's go big. We've got the internet, we can go big. No need to limit ourselves to that. So, you know, collaborations between Australia and other countries, you know, we've seen it can happen when we have to. So let's make it happen when we don't have to, and make a better world for all. And obviously, you know, I look forward to hearing more about successful case studies around collaboration. I'm hoping we'll find out more about that through our groups as we get together. So I guess that's quite broad. There's a lot of different ways that we can collaborate to drive innovation, and I don't know what directions this will spark people to go in, but I think just catching up and finding out more about what each other does is kind of a first step, in my opinion. So that's kind of it from me. I just thought it would be good to just sort of do a broad brush overview around the ways where potentially collaboration can lead to innovation, because it's certainly necessary and needed. I know a lot of, like, my kids have got some health conditions and stuff like that, and honestly, I'm not the biggest fan of Facebook, but it was through Facebook groups that I found the answers for one of my kids that I didn't find in the medical system. The medical system has since endorsed it, the ways that we've been doing things, but for a few years there it was kind of not endorsed from the top end. Like, our local practitioners were okay with it, but you know, people need to be advised of their options and the risks and make their own decisions, rather than just sort of doing what's traditionally done. So yeah, for us, it changed our lives, got us off the nightmare roller coaster and onto a way of living that was manageable and promoted our well-being. So that, and hardly anyone knows about this stuff, like things that we do either. So yeah.
Gee, I'm ready to have something to say with you and Scott.
Actually, I might know a counsellor that might be interested in coming to more of these Zooms.
Cool.
So,
yeah, all are welcome. Like, I'm not at this
I
point.
had breakfast with her this morning, so
All are welcome. Yep.
I'll see what she does on Friday afternoons. Yeah.
That'd be amazing. And then once a month we'll do it in person. So just at the North Lakes Hotel there, just on a Friday afternoon.
Oh, yeah.
2:30.
Okay.
Slodies open on Friday afternoons at 2:30, and then from 5 they've got their happy hour drink costs, and then their live music around about 4:30. So people can hang around and afterwards if they want.
Nice, very nice.
So
Gotta
that
love
one,
those social moments.
that one
Sounds
will be in
amazing.
about 3 weeks' time or something like that. So look, you know, I'm just going to make a start. And I know I had a local person say, oh, why didn't you sort of, you know, name it Moreton Bay rather than Brisbane? But the thing is, they're trying to decentralize health from Brisbane. Like, there's the geography, they're limited by the geography on how much they can grow. They're not keeping pace with demand. So they're trying to decentralize out. So I think we need the players from the city and the outer suburbs talking and communicating. Because otherwise, again, it's just going to be, oh, we'll just do what we've always done because that's all we know. And so, yeah, I think, you know, by having Zoom, we can connect with them, and then if they want to come out, they can. But yeah, so I've decided to go broader rather than limit it.
Yeah, the Chamber has their BX as well. They have their Friday afternoon drinks there as well.
Oh, yeah. What time is their BX on?
On Friday afternoon, it's like once every 3 months, I think it is.
Yeah.
Same with the Chamber, they have it every 3 months.
Yeah, I think the Chamber, they do like 5 p.m. or something.
Yeah. So, same with BX, they do like 5 in the afternoon.
Oh, okay. Yeah, I tried not to clash with anyone, so I did a Google of all of the networking opportunities in Moreton Bay, and I was like, okay, I'll try.
They all know each other. The
Yeah.
BX knows the chamber, and the chamber people
Oh,
know the BX.
absolutely. Yeah, definitely. They're a great bunch of people. So I was like, okay, I'll try not to clash with anything, so we can just sort of complement what's already happening. But in terms of health professionals, I think, sometimes they struggle to go to those things. But if we put it in a professional development context, and that by collaborating, maybe we can create something new and important. It's a bit of a different slant than that sort of pure networking and promotion and stuff like that. But yeah, we always want to have the opportunity. So, if you wanted to, I've obviously got your LinkedIn details, but at these meetings, people are going to be welcome to sort of chat about what they do and pop their LinkedIn details or websites or whatever in, and sort of let us know what they do. So but anyway, we'll be on again next week. And if I don't know, if just see if there's anyone who's interested in, obviously we've heard a bit about from Mark today on sharing a bit more for 10 minutes at the next one. Feel free.
Yeah, okay.
Let us know. Cool. All right, well, enjoy the rest of your afternoon, and we'll catch up again next time.
Thanks, Lee.
Thank you.
Bye.
Appreciate it.
Take care. Bye-bye.